Welcome to WGU Prep YouTube channel. Access all practice questions. Women's and Children's Nursing. Practice questions with answers. Question none. Which of the following is a common symptom of pregnancy-induced hypertension? A. Edema. B. Chest pain. C. Rapid weight loss. D. Dehydration. Which one is the correct answer? The correct answer is A. Edema. Explanation. Edema, especially in the hands and face, is a common sign of pregnancy-induced hypertension, which can lead to more serious complications such as preeclampsia. Question 2. What is the priority action for a nurse when caring for a newborn with jaundice? A. Increase fluid intake. B. Provide phototherapy. C. Administer vitamin K. D. Encourage breastfeeding. Which one is the correct answer? The correct answer is B. Provide phototherapy. Explanation. Phototherapy is the most effective treatment for neonatal jaundice, as it helps break down bilirubin in the newborn system. Question 3. Which of the following is a sign of preterm labor? A. Regular contractions. B. Decreased fetal movement. C. Increased fetal heart rate. D. Swollen ankles. Which one is the correct answer? The correct answer is A. Regular contractions. Explanation. Regular contractions before 37 weeks of pregnancy are the most common signs of preterm labor, and they require immediate medical attention. Question 4. Which action is most important when managing a child with croup? A. Administer antibiotics. B. Administer corticosteroids. C. Provide humidified air. D. Monitor temperature. Which one is the correct answer? The correct answer is C. Provide humidified air. Explanation. Humidified air is helpful for soothing the child's airway and reducing the harsh cough associated with croup. Question 5. What is the first step when assessing a pregnant woman with abdominal pain? A. Check fetal heart rate. B. Assess vital signs. C. Inspect for bruising. D. Perform a pelvic exam. Which one is the correct answer? The correct answer is B. Assess vital signs. Explanation. Assessing vital signs is essential to ensure that the woman is stable before further assessment or intervention. Question 6. Which of the following is a risk factor for gestational diabetes? A. Underweight. B. High blood pressure. C. Age over 35. D. Smoking history. Which one is the correct answer? The correct answer is C. Age over 35. Explanation. Gestational diabetes is more common in women over the age of 35, along with other risk factors like obesity or a family history of diabetes. Question 7. Which of the following is an expected finding in the first trimester of pregnancy? A. Decreased appetite. B. Morning sickness. C. Increased energy. D. Reduced breast tenderness. Which one is the correct answer? The correct answer is B. Morning sickness. Explanation. Morning sickness, characterized by nausea and vomiting, is common in the first trimester of pregnancy due to hormonal changes. Question 8. Which immunization is recommended for a pregnant woman during the third trimester? A. Influenza vaccine. B. Hepatitis B vaccine. C. MMR vaccine. D. Tdap vaccine. Which one is the correct answer? The correct answer is D. Tdap vaccine. Explanation. The Tdap vaccine is recommended during the third trimester to protect the newborn from pertussis, a dangerous respiratory illness. Question 9. What is the primary purpose of administering magnesium sulfate to a pregnant woman? A. Pain relief. B. Blood pressure reduction. C. Seizure prevention. D. Fetal lung development. Which one is the correct answer? The correct answer is C. Seizure prevention. Explanation. Magnesium sulfate is used to prevent seizures in women with severe preeclampsia or eclampsia. Question 10. Which of the following is a critical action for a nurse caring for a newborn immediately after birth? A. Administer vitamin D. B. Dry the infant. C. Perform an assessment. D. Place on the mother's chest. Which one is the correct answer? The correct answer is B. Dry the infant. Explanation. Drying the infant immediately after birth is crucial to prevent heat loss and to help stimulate breathing. Thank you for watching. For more practice questions, subscribe to our website at WGUPracticeQuestions.com.